So welcome to the recording studio at Govinda Medical Center, New Delhi, India. We are India's #1 premier medical health center specializing in men's health surgery, especially penile implant. If you're looking for a penile implant, then this center is the center for you. Enough of wasting time. Today we're going to compare these two beauties. So this is the made in India Indian implant, and this is the made in the US 3-piece inflatable penile prosthesis from the Rigicon called the Rigicon Infla 10X. This is just a demo piece, but similar implants also come from other companies like the Coloplast, which is called as the Coloplast Titan Touch, and the AMS called as the AMS 700 series. Now today we're going to talk about the difference between these two implants, what's good, what's bad, what to do and how to choose, and the costing for both of these. And in the end, we will show you why a patient changed his Indian to an inflatable. We also have other videos in our series about patients who changed from an inflatable to an Indian. So these two penile implants are meant for the same thing but give completely different results and are meant for completely different patients. Our penile implant is basically a prosthesis. A prosthesis is an aid, a device which is put inside the human body to fulfill some dysfunction. So if you have erectile dysfunction, that means you're not able to get an erection when you want, or if medicines are no longer working, then a penile prosthesis or a penile implant will help you get back your erection. In a penile prosthesis surgery, we take the penis, we make an incision, we make the space inside the crura. The crura are basically the two rods inside the penis which carries blood, which is not functioning in a patient of erectile dysfunction. We make space in it, and in that space we can either put in an Indian implant or we can put these two, and then the patient is able to have an erection again. Now there are two implants which are used. One is a malleable implant. A malleable implant is basically a fixed implant. This implant does not become small or large. This implant stays up for an erection and for sex, and once the sex is done, the patient can just turn his penis downwards and pack it in his underwear and he's okay. So these implants basically work on the principle of support. So what these implants are doing is that these implants go inside the penis. They give support to the penis, so they're called semi-rigid. Semi-rigid means normally the penis is not fully hard. The implant is soft. So when somebody is doing his work or is engaged in daily activities, he's not hard, but he's not soft either. But when he's aroused, when the blood gushes in, the blood and the implant together make the penis fully hard, good for sex, and once he discharges, again becomes soft, and the patient can just pack it off. But even if some patient is old, is diabetic, and there is no blood supply at all, these implants in themselves are enough for penetration. The patient can put it inside the vagina and have sex. Two of these make the penis pretty stiff and they are good enough for sex. On the other hand, the inflatable penile prostheses are completely soft. So there was nothing inside, but there is a balloon of water. So when the patient wants to have sex, he pumps the implant, which carries the water from the balloon inside these, and these become fully hard. They're fully hard, good enough for sex, and when sex is over, the patient can just press the deflate button and the water flows out, and these again become soft and the patient. So if you want something very similar to a natural erection, that is, you don't want to be semi-hard all the time, you want the implant to completely disappear and become completely concealed, and you want to get fully hard on demand, then this implant is for you. But if you want something which is technically easy, does not require too much pumping, has no mechanical parts, you want to be hard, but you are fine with being semi-soft most times, then the Indian implant could be a good choice. Now, what are the differences between both of these implants? So let's take them one by one. So first, this implant is a malleable or a semi-rigid implant. So that means this implant is fixed length. It does not increase or decrease in size. Your penis always remains semi-hard and becomes hard when you're having sex. This implant gets soft, is completely, disappears when you're deflated, but when you make it erect, it becomes fully hard. And these implants also are able to increase the length and the girth by a few extent. So when patients pump it up, they feel that the penis is increasing in size. They are mimicking a natural erection. So if you say which is the most natural, then obviously this is the most natural. But if you see which is the most easiest, then this is obviously the most easiest. This implant is made in India. It is made in a facility in India, which is WHO approved. But again, this is a made in India implant. These implants of all three companies, the Rigicon, the AMS, or even the Coloplast, are made in the US. These implants require a very high level of technical expertise, and they are exported all across the world from the United States of America. Cost-wise, the Indian implant is the most affordable solution to restore erections anywhere in the world. So for $3,000, including the surgery price, the patients can restore their erections. So a lot of patients with affordability issues choose this implant for long-term usage. These implants, as usual, because the exports from the US carry a lot of duty, taxation, IP rights, so these implants tend to be expensive, and the average price for this implant would be something from $11,000 to $12,500 in India, and they would cost anywhere between $20,000 plus if you're looking at Europe or the US. These implants, since made in India, are only available in India, and to get them serviced or repaired, you will have to come back to me or to the Indian surgeon who did these implants for you. These implants usually carry a worldwide warranty, and even if these implants go bad, you can contact the company and maybe receive assistance anywhere across the world. These implants don't get spoiled, so these implants kind of work lifetime because these are silicone rods. There's nothing to get spoiled in them, so patients with these implants tend to live with these implants without revisions for 25, 30, 35 years. So this is really low maintenance, really nothing happens to them, and they last a lifetime. Being mechanical, these implants tend to have failures. Sometimes these mechanical parts fail, there's leakage, the pump locks up, and these implants usually have a life of 10 to 12 years, and in a 25-year lifespan, the patient may need to replace these implants once or twice, depending upon for how much duration he's carrying the implant. The Indian implant does not provide you any length or girth increase. Whatever length or girth the surgeon fits for you on the day of surgery tends to stay with you for your life. So what we do is that we usually put in maybe half an inch larger implant inside the penis. So what happens is the patient gets a little bigger, gets a little, the size is bigger, but that size tends to remain fixed throughout his lifespan. In the three-piece, because the implant can be inflated, the patients can end up with 20 to 25% of size increase over usage time. So many patients will increase by half to 1 inch as they continue to use their implants over many years. Now compared to the hardness, now if your target is not concealability, if hiding the implant is not important, if what you're looking at is size, if what you're looking at is hardness, you're looking at the punch, then obviously the Indian implant is going to be harder because it's solid. So because it's solid silicone, obviously silicone is always going to be harder than water. So if you look at the hardness scores, the Indian implant scores better over the three-piece. So patients with the Indian implant have harder, stronger erections, it feels more firmer, and definitely it is going to be much more pleasurable for the women as compared to the water-filled implants. But if you're looking at concealability, if you're looking at completely making the implant disappear, then obviously the concealable implants tend to be softer and completely disappear once sex is over. But there have been head-to-head studies on women's pleasure, and every single time the malleable implants tend to be harder. So the patients who undergone a three-piece go back to Indian, they will always have a comparison and they feel this implant is much harder. But if you're looking for concealability, if you're looking at hiding the implant, then obviously this implant, the three-piece is more concealable, tends to disappear. Okay. Then in terms of complications, the complications of both the implants are completely different. Now the operating time of the Indian implant is just 15 minutes because we don't need to enter the scrotum or the abdomen. The implant directly goes inside the penis. So the surgery duration is very short, because of which the recovery period, the pain, the post-operative workouts, everything tends to begin earlier. The patients are able to pee more comfortably, and these implants tend to recover very fast. In this case, because we are putting a part inside the scrotum, we are also putting a part inside the abdomen. So these implants take 45 minutes to an hour to operate. Because there are more components, it takes more time. There may be some bruising, swelling, redness, and the recovery period is slower than the Indian implant. The Indian implant can be utilized immediately. So for example, if you are the implant, after 21 days, you are fit for sex, whereas in the three-piece implant, you need to learn how to use it. And most patients can have sex after 6 to 8 weeks. But once the 8 weeks period is over, this implant is much more comfortable because you can push it down. There is no long-term pain. There is much more easier to pass urine because you can push the implant down. And most importantly, there is no erosion. Erosion is basically in which the implant protrudes outside the penis, because after sex, the penis gets time to recover. Whereas in these implants, there is always a 2 to 3% chance of erosions because these implants are always hard, and sometimes over chronic, years and years of use and years of sex, sometimes they protrude out of the penis tip and they need a revision. So all in all, if I would say the gold standard implant, the implant that is utilized everywhere around the world, is the 3-piece. But it is not because the 3-piece is a better implant. It is because the 3-piece is what the American surgeons are primarily trained in. But for many men, older men, younger men, men looking for more hardness, men with big penises in which these implants tend not to give good support, in men who want an easier life, or men who want a lifelong implant, or men who do not want the entire problem of locking in device malfunctions, the Indian implant could be an extremely good choice. In India, in my practice, we perform around 100 to 125 penile implants in a month. That is the largest number in Asia and maybe even Europe. But out of the 125, 100 to 110 patients choose the malleable implants, either the Indian or the Rigicon. And around 15 patients choose the inflatable. This is primarily because of 3 reasons. One, this implant is expensive. For a country like India, which is cost sensitive, doesn't work that way. Second, we are a reference center for malleable implants, and many patients come to us specifically for the malleable implant. But if you want to go for an inflatable, it is also available. Like it, share it with your friends, and maybe subscribe to my channel to stay up to date with the latest in penile implants. Thank you so much.
Hey kid, don't ever let them get inside your head. They'll tell you what to do in life instead of everything you know that you could get. Don't let them guide your life towards regret. I'll fight for what I love with every breath. My past is filled with things I won't forget. I use them all to push me to my best.